It's going to be hot today. It's going to be hot through probably October. And as temperature and humidity levels build up there throughout the summer, the risk of heat-related illnesses such as heat stroke and heat exhaustion also increase. It's important that you and your family know how to prevent and treat heat stroke and exhaustion. And Dr. Brent Wallis, Dr. B, our friend from People's Health, joins us to talk about the precautions to take when the temperature starts to rise. Morning, Doc. How you?
I'm doing great, Tommy. How about you?
I'm good. Good to talk to you again. Who has a higher risk factor for heat-related illnesses?
Well, really anybody has risk for heat-related illnesses, but in particular, seniors or people over 65 can be higher risk because their bodies may react differently to changes in the temperature. You know, risk factors such as certain health conditions, such as diabetes, can cause your body to respond differently to heat. And then, of course, all of us who live in Louisiana, an extremely hot and humid climate, have a higher risk. The other thing to keep in mind is certain people who are taking medications, common medications for blood pressure, even antihistamines, can cause dehydration, and that can lead to heat-related illness as well. And then people who don't drink enough water. It's pretty common that people don't think they need to drink a lot during these hot summers, but they really do.
Is it true that once you start feeling thirsty, or by the time you start feeling thirsty, it's almost too late?
Definitely, yeah. You need to make sure you stay hydrated along the way. Once you feel thirsty, it's really harder to catch up.
Some of the warning signs for maybe heat stroke or heat exhaustion, or the difference between the two?
Yeah, in common with the two, you can feel a little bit faint or dizzy. You can definitely get a little bit of nausea or vomiting. Muscle cramps are pretty common because of the dehydration. You can have a fast or a strong pulse. What's really concerning, though, is loss of consciousness. That follows a little bit more with heat stroke. The way to discern the two is that heat exhaustion, usually your skin will be cool and kind of clammy, whereas with heat stroke, you tend to have red, hot, dry skin because you're not sweating to actually reduce your heat. And if you have anything like that, that's an emergency. So you could call 911. Excuse me. And while you're waiting for someone to help you, or while someone is with you, they should make sure that you get to a cool, air-conditioned place and try to reduce your body temperature.
You like things like a cold compress. Where do you put that?
Typically, if you can put one on your forehead for sure, but actually in your armpits and on your pulse points,
really?
So around your wrist, that can definitely help.
Top of the head, neck, or anything? The preferred place would be, though, tell me again, the armpits or wrist?
Yeah, you lose a lot of heat through your head and through your armpits, and so if you put a cool compress in those areas, it helps to dissipate the heat as well.
And of the two, heat stroke is the far more serious?
Yeah, heat stroke is very serious. That's a medical emergency that can actually result in cardiovascular complications. So you actually need to see a doctor immediately for heat stroke.
We're going to pick it up here when we come back. We'll talk about preventing it. And, you know, Dr. B, I always said it's if you have to take a break while you're cutting the grass in the summertime or what have you outside, it doesn't mean you're getting old. It means it's hot, right?
Definitely, yeah. And maybe you shouldn't be doing it.
And you don't see any dogs out there running around the middle of the day. The dog has a sense, or cat or what have you, to lay underneath a shady tree, but yet we're out there trying to get our jogging in. 8:20 more with Dr. B when we come back. People's Health, as we talk about heat stroke and heat exhaustion and staying safe in this brutal heat and humidity that we have here in southeastern Louisiana. Traffic, that's what we do now on WWL. 8:25, Tommy Tucker, WWL. I left Thursday mornings. We're close to Friday, and we also get to talk to Dr. B. Dr. Brent Wallis, he's the Chief Medical Officer of People's Health, and we give you some tips to help you, not just if you're elderly, but if you have parents that are seniors, and of course that's a relative term, elderly, but your body does change, I guess, Doc, as you get older, and as you said, if you're, are you more susceptible to heat just because you might be getting a little bit older?
Yeah, definitely. Seniors do have a little bit more trouble handling the heat. They actually sweat less, and sweat is what helps us drop our body temperature. And then, as we mentioned, some of the medications that they can take can actually cause problems as well.
And I was saying earlier before the break that, if you have to take a break, it doesn't mean that you're old. It means that it's hot. But as you said, or maybe you shouldn't be doing it in the first place. I wanted to follow up on that real quick, because maybe at some point you do have to, discretion's a better part of valor.
Yeah, definitely. I mean, really during hot days like today and really most of the summer in Louisiana, one of the best things you can do is just stay out of the sun. If you do feel like you need to be in the sun, say you've got a little yard work to do or you want to exercise, it's much better to do that either first thing in the morning or later in the evening when the temperature's dropping a little bit. And when you do go out, making sure that you're wearing, loose-fitting clothing can help, because that allows you to dissipate that heat a little bit better as well.
I guess stay out of the sun, as you were saying, drink a lot of water?
Yeah, water is extremely important, and like you mentioned, by the time you feel thirsty, you're probably already at a point where you're a little bit dehydrated. So it's real important to take a bottle of water with you and make sure that you're drinking along the way, so that you're staying hydrated and not actually losing that water that you really need.
And don't forget the sunscreen.
Yeah, always, especially during the summer in Louisiana.
Is there some number that's better than the other?
Usually we recommend SPF 15 at the bottom line. I think if you're going to have extended sun exposure in Louisiana, you probably should go higher than that, an SPF 30 or higher.
Yeah, I'm talking about yard work, and exercise, some people, and it's hard to believe that they just don't have air conditioning in their home, and if that's the case, I guess this could be a serious health hazard as well. And what are some of the things that they can do, Doc, to stay safe?
Yeah, it's really surprising, but there are a lot of people in New Orleans who don't have air conditioning, and so they rely on keeping their windows open to cool themselves. Air conditioning is also pretty expensive, so some people don't run it all the time. So, fans help a little bit, but they don't necessarily drop the temperature. They just make you feel a little bit better. So you really need to try to stay in air-conditioned places when it's extremely hot. And, the city usually will set up air-conditioned centers when it gets extremely hot. This pandemic that we're in is kind of interesting, because I know people are probably going to have some concerns about going to a location, even going to a shopping mall or somewhere indoors in order to cool down. But it is important, you can still cool down and maintain that social distancing that you need to help lower your temperature and prevent any sort of heat-related illness.
What about sons and daughters of seniors, or maybe people that are paid to take care of seniors, some of the things that they should keep an eye out for the people that they care about and care for with this heat and humidity?
Yeah, I mean, if you're taking care of your parents or taking care of a senior, you definitely want to check on them frequently during the summertime, and especially like we mentioned, if they don't have air conditioning in their home, it's even more important. You want to ask them if they're drinking enough water, make sure they're staying hydrated. If they don't have access to air conditioning, you may need to assist them to get to a place. Make sure they understand how they're doing, what symptoms they may be having, and that they understand what those signs of heat stress may be. And again, at this time when we're not necessarily seeing our parents as frequently as we could, it's just as good to give them a call on the telephone a couple of times a day to make sure that they're doing all right.
Thank you, Doctor. I appreciate your time. Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. Have a great 4th of July. You can visit peopleshealth.com/radio. You can call 1-855-821-2666. You can always check out People's Health on Facebook, Twitter, or Instagram.